understanding a little bit more about the benefits of regenerative medicine can really impact your life. If you're struggling with something like pain or joint dysfunction, or even facing surgery or limited function, regenerative medicine can really provide a way out of pain, a way to avoid surgery, and in a way that helps the body do what it's supposed to do by healing and repairing without drugs, without surgery, without those risks. So my goal in this video is to teach you a little bit more about regenerative medicine and how it works, and if you might be a candidate who could benefit from regenerative medicine. So one of the things that regenerative medicine, whether it's PRP or stem cells or ozone or peptides, all of those can fall under the umbrella of regenerative medicine, even hormones really. Anything that helps the body to repair, replace, kind of proliferate good, healthy cells can fall under the category of regenerative medicine. One of the foundational definitions of regenerative is that it helps the body to repair in ways that it was intended to repair, but maybe the body has been having trouble, or because of age, the body is not repairing as well as it should. And so these regenerative treatments can help the body to do, again, what it was supposed to do in the first place. Some examples of regenerative therapy I mentioned a little bit already. Stem cell therapy, which we really shouldn't be calling it stem cell therapy, but it kind of rolls off the tongue nicely, and that's how people sort of understand it. Really, there are typically not cells in these injections that themselves turn into cartilage, bone, organs, tissue. Really, what it does is put into the joint or tissue cells that are master healers, that signal to the body a powerful signal of, hey, you need to heal this area, whereas before the body maybe kind of was ignoring it because maybe the damage had been so ongoing or long-term. And so it has anti-inflammatory factors in it and kind of signals the body also to tune inflammation exactly so that it's at the right level, not too low, not too high, not inappropriate, but appropriate environment for healing. And then decreases inflammation. Some inflammation is good for healing. Other inflammation prevents healing. So we want to moderate and kind of tune and adjust that. And then also it calls all sorts of healing factors to the site of injection so that those tissues can then be signaled to really regenerate in healthy ways. PRP is another regenerative therapy that you may have heard of. PRP requires drawing a vial or two of blood, not a whole lot of blood, spinning it down, and it's a very specialized tube with specialized additives in it that we can then use, spin it down, separate the red blood cells from the platelet-rich plasma, and then we can inject that platelet-rich plasma, PRP, into typically a joint is where it's most often used, to cause a little bit of inflammation, that good inflammation, which then will call the body's resources to really heal that area. So it can kind of kickstart the healing process. One difference between that and stem cell therapy or the Wharton's jelly injections, amniotic fluid injections, exosomes, that kind of thing, is that the PRP is intended to first increase inflammation, because anywhere there's inflammation, the body is also going to say, hey, over there, like, go heal, go send the healing factors over there. And then peptides. Peptides are really important and can actually be used as an adjunct in addition to PRP or other stem cell Wharton's jelly injections for healing, because again, these peptides are signaling molecules, often molecules that actually are in our body anyway, but having a bit of a boost of them or a boost in a certain area, so an area of injection to the knee or the back or even into the face, into the hair follicles. We can even do PRP or peptides, even stem cells, to regenerate hair growth or regenerate the skin for a more youthful appearance. Or we can even inject peptides, like BPC is a really popular one, into tissues and joints for improved healing. So what are some benefits of regenerative medicine? Well, it regenerates tissue, so it's a perfect name for it. It can help to regenerate degenerated or damaged tissues. As we age, we degenerate. And so having a therapy that can help those tissues to turn over once the cells become old and aren't functioning as well or are damaged, to have those cells turn over and have new, fresh, wonderfully functioning cells. So that's regenerative. In the same line as tissue regeneration, imagine a knee that's arthritic and the cartilage has been degenerated because of maybe years of walking on it. Maybe your feet have been, pronated or supinated, or your hip's been out of alignment, and so that's been causing some malalignment of the knee, causing cartilage degeneration there. Sometimes, very often, these regenerative injections can help those tissues and even the cartilage to heal and repair, and also then at the same time decrease pain. And even if there is not tissue regeneration, there are studies that show that pain decreases after these injections, which is so cool. To kind of continue on that line of thinking, pain reduction, because of the reduction in inflammation and immune response, and also of course because of the tissue regeneration and healing that happens, pain is decreased. And so instead of now taking opioids or other pain pills, ibuprofen all the time, which have risks, now we can give these injections and eliminate pain. Another benefit would be improved functionality, right? Who doesn't want to walk around and have no pain, or be able to walk around in the first place? If you love to travel, if you love to play sports and you're in pain, that's going to hamper your ability to function in life and function happily in life. So a reduction of pain and an improvement in function is huge with these injections. And of course, if you've been living in this world, you've probably heard of the opioid epidemic, and that is a real thing. I used to work in a pain clinic. I prescribed all those medications, and I prescribed them what I would say is very wisely and necessarily. These patients were in a ton of pain. We didn't have access to these regenerative injections at that time, and I wonder, as I look back, if we could have avoided a lot of the prescriptions, especially at the levels that we did, if we had had access to this really amazing and exciting injection regenerative technology. Everybody ages. Everybody's body's breaking down, some at speeds greater than others, but we can help to halt or slow that process of age-related degeneration with these injections. And that's really exciting, because then we can improve function, decrease pain, decrease the need for surgeries, and just improve overall quality of life. Whenever the topic of stem cells comes up, inevitably I get questions about, well, where do these come from? Are these from aborted fetuses? And the answer is 100% no. These tissues, these injection products are coming from what would otherwise be waste product from healthy births. So it's either from amniotic fluid from healthy babies, full-term C-sections, or from the umbilical cords. So the Wharton's jelly is what makes up the umbilical cord. And what's neat about the Wharton's jelly is it's a non-Newtonian fluid, essentially. So when it's under pressure, it provides really good support and almost hardens, if you can think of it like maybe cartilage. And then when it's not under weight pressure, it can move freely and can help the joint to move more freely. That Wharton's jelly, that cord, is structurally amazing tissue. And so when they can purify that in an FDA-inspected lab, and these moms are highly, highly tested, highly, highly screened. And then of course the products are highly tested, highly screened. Babies are going home with their moms. These tissues are going to the labs for processing and then for injections, regenerative injections, which is amazing. There are several labs out there who do process these birth tissues, is what we call them, and some are better than others. So when you're thinking about regenerative injections, you really want to know that the provider who is injecting these into you has vetted the lab, has looked into it, made sure that their processes are, they've been inspected by the FDA. The lab that I use invites the FDA to come inspect them, even though that could be a major business killer. If they were to fail that inspection, they invite them in. This lab knows that they're doing everything right. They have no fears about passing inspection, and they invite the FDA in. I have seen so many good results from this lab's product. I have the most faith in it. We always want to make sure that informed consent is a part of any treatment process, whether it's an injection of any kind or hormone replacement therapy like we do, or really anything. The patient needs to be educated and informed about the treatment and the risks and benefits. And anytime you do anything to a patient, there's of course risks and potential benefits. So having that discussion and really picking the right patients for these injections, I want to make sure that whenever I inject a patient with this, that I am the most sure that we're going to get good results. Because if you don't get better, that looks bad on me. That's not not great for you. So I always want to pick patients that are going to get the best results. And part of that is what's going on with the tissue that we're targeting. What is the patient's environment like? Are they hormone imbalance? Do we need to fix that first? Are they nutrient deficient? Do we need to fix that first? We want to put the body in lifestyle ways, so sleep and exercise, diet, stress. We want to put the body in a position to succeed, ideally before we do the injections, but certainly during or after. So picking the right patient and making sure we prepare the environment is essential to getting the best results out of these injections. So to kind of wrap up, these injections, these Wharton's jelly injections, exosome injections, amniotic fluid injections, decrease inflammation or tune inflammation, tune the immune system, and then also call the body's resources to really powerfully regenerate tissue, regenerate damaged tissue. And that can make a huge difference in somebody's quality of life, both from a function standpoint, enabling them to walk upstairs again, play with grandkids, get down on the floor, play pickleball again, but also in terms of pain. And then that affects other life parameters like sleep, like family relationships, like spousal relationships, like the ability to be a good parent. Because if you're in pain, you're not functioning well, that impacts those functions. So before you jump to surgery for your knee arthritis, for your rotator cuff partial tear, for your labral tear, look a little bit more deeply into these regenerative therapies. They are newer, but they are really promising and really exciting. And then make sure you pick somebody who knows about this stuff and isn't telling you that they're injecting stem cells, that these stem cells themselves are turning into your own cartilage. That's not how it works. Make sure you're comfortable with the person. And ideally, they're using ultrasound guided injection for your joints. So just make sure you do a little bit of due diligence and research. You could potentially avoid surgery, avoid being on pills that you don't want to be on that have, of course, other side effects too. So this is a really exciting, newer therapy that I'm just thrilled to be able to offer. So next steps, if you're curious about this, would be you can even schedule a discovery call with me. Usually what I like to do is find out more about you during these calls. We spend about 15 minutes going over, why did you call? Why did you book this call? What's going on with your knee, your elbow, your hip? And then for me to answer any questions that you may have, and I always expect questions. I love to educate and I love to make sure that my patients are informed before they do any treatment with me, whether it's hormone replacement therapy or supplements or these awesome regenerative injections. So you can book that discovery call on our website, nourishhousecalls.com.